Da una crisi che nasce l'inventiva, la rivoluzione, il merito. Solo dopo una crisi si apprezza il prima. È ferro fuso quello che stiamo maneggiando e dobbiamo trasformarlo in un'opera d'arte. Non andrà tutto bene se non avremo cura della nostra responsabilità. Non andrà tutto bene perché le cose non vanno bene da sole. Bisogna riportarle nel loro posto. Bisogna tenersi le paure, seguire le regole, condividere il coraggio. I sacrifici di ognuno convergeranno al centro della vita di tutti. Ritroveremo i piccoli gesti, avremo nuove priorità, nuove famiglie, nuove idee a cui appartenere, nuove occasioni di comprendere l'essere umano. Porteremo con noi le memorie di chi avrà lottato e il rispetto di chi ci avrà salvato. E forse scopriremo che il mondo non è così diverso da come lo abbiamo sempre immaginato. Ci alleneremo a prenderci per mano, danzeremo sulla vita, ascolteremo i silenzi. Perché non siamo un insieme casuale di persone. Siamo viaggiatori, esploratori, pionieri. Niente sarà contagioso come il buon esempio. Solo così la normalità rientrerà nelle nostre vite. Più potente, più densa, e anche i sogni torneranno.
Good morning, Deep. Great to have you on the Digital Excellence Pharma Academy on the very first day of 2021. I think many of us were just waiting to get into 2021, although the virus hasn't changed, or at least hasn't changed for the better. I hear that now you have two strains of virus, the Chinese and the British. So when the path lab calls the doctor and says, "Doc, your patient has tested positive for COVID," the doctor in turn asks, well, whether it's Chinese or British.
Good evening, Anup and ladies and gentlemen. It's wonderful to be here back, especially in 2021. And I take this opportunity to wish everyone 21 will bring new hopes, new skills, and new opportunities to meet your career and life's aspirations.
So great, Deep. 2020 was very different year. And how has it challenged you and how has it changed you?
Oh, many ways. I think that something I realized initially is that the old ways of doing things will not work. Okay. And we learned very quickly to work remotely. All the work that which we were doing earlier, it was a challenge to shift in terms of developing new tools, instruments, and things like that to digital. But I think that what we found in the process was that gives us lots of flexibility, added efficiency, and huge effectiveness. And that really worked well. So looking back, I say that the change was tremendous. And it's really that beneficial as we look at the future of work, provided us a very different dimensions. From the professional standpoint, I think that it forced us to think differently and quickly adopt the new skills, which was, I wouldn't say the technology was not there and things like that. Those things are available, but we never thought important. And then we adopted that. So that's something wonderful happened because of 2020. And I'm sure that for many people that that's going to define the career for them. Just to give you more perspective on this, and I think that it's important that I must mention to you that not everyone is as lucky as possibly that what I have gone through. Why? Because that last 3 months, if I look back, I get that many distress call, either the business shutting down, and I'm talking about pharma. And pharma, we say that is not as impacted as other industry, but within pharma, that there are industry, medical device, and there are companies. There's a very well-established medical device companies, and then there's a very senior people, proven, very good, high potential, but then now they are asked to change the role, and they are not prepared for that. Yesterday only that somebody sent me a training manager, a regional training manager, right? And looking for, because their company decided to change the regional training manager structure. And likewise that there are many. So on an average that every other day, I get one distress call for help. And so it's important that what we can do or what pharma leaders can do to future proof themselves. And something which is immensely important, I think Medicine Man, CreditWeb, DEPA can help.
So great, Deep. Wonderful perspectives about future proofing ourselves. And that's exactly what we are trying to do at Digital Excellence Pharma Academy, a joint initiative of CredoWeb that has been going on for the last 9 months. And from May to December, we have done over 60 webinars on various topics about which I will talk in a while. But let me ask you, Deep, as to what do you think should be the priorities for Indian pharma business leaders in 2021 and even going forwards?
I think that that's very appropriately put. The Gartner, they surveyed about roughly about 800 HR managers and asked them that what are their top priorities for the new year 2021. And a vast majority of them, 68%, said that building critical skills and competencies are important or the topmost priorities for them. Now, when we talk about this, building competencies, what are the challenges these guys are saying? The major challenge, 36% of them said that we don't know what the skills gaps are at the current employees they have. So they don't know that grouping in the task, that how to develop them. We don't effectively integrate learning into employees' workflow. So that you have learning. I'm also wondering when, during the lockdown, that a lot of companies were training their people, but then what they are training and what the people are supposed to do during that time, there was no or hardly any connection. So that's kind of synchronized with that. And the third, I think that 31% of them said that we can't create a skill development solution fast enough to meet evolving skill needs. That's also true that pharma marketing or take, for example, the sales force, they don't know how to use that digital medium. And I think that even today that many companies are groping in the dark that what they need to do. Your initiatives are important and that's what might help. So the top priorities for leaders in pharma is same, that how to build the critical skills and competencies. There might be others which deals with the change management, organization design, current and future leadership. And I think that was all time that is going to be important, because I think that many people believe that the current leadership may not be effective enough to adopt and accelerate the pace of change. And hence that, how do you really ensure that wonderful employee experience? So these are the 5 top priorities. And I think that Indian pharma leaders and HR managers should be quite sync with these priorities.
So, Deep, you have very well articulated the top 5 priorities for leaders, whether they are in business or in HR. So, how does one go about future proofing for 2021 and beyond?
Let's talk about our career as a professional. And we often hear advice, if you take our parents to get into professional career degree, learn the trade, good at his specialty, join a big company with good benefits, stay until retirement with good pension or other benefits. I think that stage is over, because may this work for them, but no longer is a advice that might help. And then you look at professional advice or the current advice, that's also I don't find very compelling. And usually they say that find out your strengths are, what you're good at, avoid your weaknesses, find a place where you fit. The problem is that most of us fit best with the people, those who are similar personalities or interest. And there are many, many studies that show that if you look at that kind of place, the fit personality, organization fit often does not relate to success. Then I remember that sometime back that you put a post, and I'm going to refer to that. There are what we call it happiness missionaries and their cousins, right? The passion police. Okay. So they say that find out what really makes you happy, comfortable, go and find a place that fits your needs, settle in. And this is another pleasant sounding argument with several holes in it. Personal motives change over a period of time. Happiness gets defined differently as we age and as we learn what the real career opportunities are. I think that fundamentally the issue is that we all like to do what we are good at and comfortable with. And the vast majority of us nest building, comfort zone seeking, return to the middle. And if you use the biologics, that homeostatic, right? Habituated people. We tend to be more comfortable repeating. Even our bodies are designed to keep all that is needed, temperatures, hormones, blood chemistry, center around the green and safe zone. So in that sense, as a human being, people, we are designed to find and build our physical and psychological comfort zone, and we fight to stay in it. And that's the reason, probably the reason is that change is so scary and unsettling. So if you are in sales, you would like to be in sales. You don't want to venture out to another areas and things like that. So if you would like to future proof yourself, then I think that you need to think differently. And what I mean by thinking differently, and that's where that I'll kind of relate with the DEPA initiative. And if you really look at that certification process, the thought behind is that the entire process is designed to help you with the holistic learning techniques, right? Which not only that introduce you to a new skills area, models, techniques very differently, but also that help you to contextualize by linking your career challenges and the skills with the business issues, which means that in a way that this entire initiative is actually that forces you to see that in workplace what kind of challenges that you are facing and what kind of new skills that you need to develop, right? And then you see that if I develop this skill, this is what I will able to do better. And if you really venture out and then initiate a pilot, then you have opportunity to practice the skill acquisition, link the skills with the business challenge, and what we call it is learn and practice with the real world issues. In a way, because this is a pilot, your entire experience is risk free. And once you have that experience and your organization that supports you in terms of building the accountability in that area, embed with your developmental plans and track the progress, that's where you are future proofing yourself for any role that is assigned to you in the event of changing the organization requirement, downsizing, or anything that happens. And that's something which is important. So that's the path DEPA is actually what we have done is ensure that the people have skill-based development path.
Great, Deep. It's very wonderfully captured, and it's almost the way that we develop as human beings. We begin our lives by crawling, and then maybe a year later we learn to walk, and then if you have some athletic disposition, you will run, and then eventually, as we say, give your kids not only roots but give them the capability to fly. So I think these are very well captured, that you start by crawling and then you start walking, then you develop the capability to run and then learn to fly. And all the while, keeping the real world issues in mind. Great, that's very well captured. So, Deep, you have done a wonderful job of envisaging an architecture to develop digital capabilities. So, over a period of time, I think all of us have realized that even from the earlier slides that you showed, that talent is the real issue and we need to build talent. In fact, a new breed of effective pharma business leaders. And that is how we started DEPA. And we also did a deep survey about which you have already spoken. And then all those webinars by 19 thought leaders from Indian pharma as well as from people all over the world have spoken. We have put it together into 4 modules, beginning with leadership because everything rises and falls on leadership, and then into the new skills of the digital world. What is digital? How does one relate to it? And how does one adapt it and contextualize to the business challenges that pharma is facing currently? And as a result, what are the changes that are going to happen in sales and sales management? And therefore, how can we bring more customer centricity and patient centricity? And that is very well constructed over here. And we have just begun the leadership module. So this is also a very interesting approach to learning. As you said earlier, that unless we contextualize our learning and practice with real world issues, our learning is never complete. So therefore, the medicine man 70-20-10 holistic approach to build digital competencies where the 70% is experiential learning, and therefore they need to do a pilot that addresses some of the challenges that they are facing in the current scenario, and then a 20% learning when they share their learnings either on the DEPA platform or with their colleagues at their workplace. And the 10%, those webinars, the 60 webinars that we already put out are already available to people. And I would really request them to go and spend some time because this is essential to change your mindset and to build a new digital mindset with these resources that we have put out by way of 60 webinars and question answer sessions. Your thoughts, Deep?
You very well articulated this point, and it's important. And let me just share with you what I believe the pharma in India and elsewhere that suffer most is a gap between knowing and doing. So when we speak with many people, I don't see that there's many issues in terms of knowing aspect. They know what is right and they know in details majority of things. But when it comes to applying what they know, then that's the big gap, because many people are not able to deconstruct that their knowledge or their understanding of things, how to initiate, how to use this knowledge in order to transform whatever the initiative that you're taking. And that's the reason we thought that instead of making people listen to the webinars, which is so essential, but also that it's very essential for people to relate with their workplace challenges, the business issues, and see how what we are learning can be translated into a meaningful pilot project and you can work there. And that's how the whole framework works, right? And this is the appropriate example.
Great, Deep. 70-20-10. So pharma has to unlearn its old 80-20 and learn the new 70-20-10. That's a very useful framework to go by. You have brought in a vaccine of your own, in addition to that of Pfizer, Moderna, and the Oxford and the other Indian efforts that are under place. So, give us a brief overview of how you plan to deliver this program and how people can go about getting certificates of participation or certificate of competencies.
Well, why we say vaccine, the change vaccine, because this methodology or this framework and DEPA architecture will future proof people if they really get into the certification process in terms of understanding these 4 factors of digital transformation. We all know that the biggest gap today lies in any organization that differentiate between a successful organization and an average organization is the availability of talent. I think that this is universally true. It's not only in India, but anywhere in the world, the war for talent is huge. So this is an opportunity for pharma professional in India to possibly build the necessary skills that help them to acquire more significant roles, which is what we say the future ready roles. So as you explained beautifully, those are the process of certification and things like that. And that's where these four areas of leadership, digital transformation, sales and sales management, and customer and patient centricity, they are all kind of well aligned and integrated together, right? So these are not an isolated factors, but these are the factors which are well aligned and very well integrated pillars for digital transformation.
Great. And I think in each of these modules, we have wonderful leaders who have come out and shared their insights. And today we will just briefly look at what Mr. Hariram, the chief mentor at Medicine Band for the last 10 years, he has helped us to stay together, play together, and learn together. So do give us some insights, Deep, as to what you think are the key insights and the takeaways from Mr. Hariram's session.
I think that I'll get back to what I said earlier, the gap between knowing and doing. I think that the personality or professionalism of Mr. Hariram really symbolizes that. Why? Because he's the one who is not only sharing the wealth of knowledge of his experience, but also as a practicing manager, what he has done, that becomes much more impactful for anybody. And I think that that makes Mr. Hariram as one of our favorite speaker. He's very passionate about the culture part of it, or the cultural transformation. He speaks about Sumanta Goshal's examples of smell of the place. And we're talking about that as a leader, you need to change the smell of the place. He gave a wonderful example, and another very good way of articulating is the storytelling. So he talks about that guru's cat, how we all in one way or another attach ourselves with some rituals and practice those things over a period of time without realizing how ineffective and outdated those things have become. But still, we believe that this is what has given us success, so we shouldn't leave all those things. And then he talks about the concept like digital Darwinism, right? So how do we adapt or perish? And I think the very important point, and I would like our audience to really pay attention, is how do you talent, trust, and technology, the mixture of these three T's can help us overcome some of the leadership challenges.
Great, very well articulated, Deep. The Guru's cat also reminded me of a lot of the ineffective things I learned at Pharma. And when I look at the trainings of many companies, those are still there. What is the plasma half-life and what is the area under curve? The bioavailability questions. And when I still think about that half-life, that was a key question. I spent half my life trying to figure out what this plasma half-life is all about. And no doctor was interested or asking questions about that, whereas his challenges were, how do I make my patients more compliant? How do I make them to change their lifestyles? How do I ensure sugar levels are kept at manageable levels? The hypertension is manageable. So this is very well captured by Mr. Hariram, that the cat is just hanging around there. And I would request our audience to go take a look at the 4 webinars and question answer sessions that we've had with Mr. Hariram to really understand. And I think he made a very valid point, giving a lot of data to show that the behavior changes when the smell of the place changes, or rather when the context changes. And that's the task for leadership, is to change the context in which we are working today has changed dramatically, and to accept that. And when we do that, I think digital adoption, or rather, as Mr. Hariram likes to call it, as a digital evolution, will pick up and take its own pace. So great. That has been a wonderful learning session so far, Deep. And I should really thank you for making this happen. Deep, as we come to the end of the session, your thoughts in closing. I'd be very happy to take you through the slides again so that our audience can have one more glimpse at it, but I would rather upload it on SlideShare and they can go and revisit it, or rather watch this video a couple of times.
Yeah, thanks, Arunu, for providing me this opportunity right at the beginning of a fresh new year to talk about something I'm very passionate about, you are very passionate about. And I think that as the Gartner survey talks about, possibly one of the top 5 priorities for leadership across, and more specifically for the HR leaders. And I'm very happy if our audience use the discussion forum to share what they believe, what they feel, and whether they are in sync with what we are talking about, or whether they have something important to talk or ask question, or possibly that just comment. And I think that that's how we all learn, using the collective intelligence, collective wisdom.
So great, wonderful way to begin the new year, Deep. You have given us 5 priorities for leaders, and then you have very well articulated the challenges that we are facing, and therefore the necessity to build talent, and then given a very practical way of going about this by way of 4 modules of leadership, digital, sales and sales management, customer and patient centricity, and then position them as a vaccine against reinfection to the old way of doing things. I hope that when they take these 4 modules, or rather 4 doses of the vaccine, it will build in them a strong immunity, and that will help them to navigate the challenges that has been accelerated by the COVID lockdown, by the crisis, and everything that has followed. So, thank you very much, Deep. I wish you a wonderful new year ahead, and I wish all our readers a wonderful 2021, which is much better than 2020. And as you take these learnings to heart and relate it to the work issues and do a pilot with us, it will help you to really future proof yourself for the future. Thank you once again, Deep.
Thank you very much, Anup, and take this opportunity once again to wish everyone a wonderful year ahead. Thank you.